to an update on our WSAZ investigation. Deadly details denied when a teenage girl in Boone County died last year because investigators say she was starved to death. We started asking the state questions about what it knew before she died.
Well, we also filed a Freedom of Information Act request for the same information in other child neglect deaths, but the state denied our requests, despite federal law requiring that information to be released. So when Governor Morrisey took over in January, we sent an email asking if his administration would reconsider our records requests. And tonight, they have released all that information and made it clear it's information that belongs to the public.
It was a death beyond comprehension. Investigators in Boone County say this 14-year-old girl, Kennedy Miller, died from starvation. Her death in April 2024 led to the arrest of her mother and grandparents. All had pled not guilty in the case. Kennedy's death also sparking our WSAZ investigation into how this could happen and what the state knew before she died. So we sent Freedom of Information Act requests to the Department of Human Services. The department initially wouldn't give us any information, but we researched state and federal law and found this line. The department, in case of a child neglect fatality, shall make public information relating to the case, including any prior history the state had with the child. A former WSAZ investigative reporter asked then Department of Human Services Secretary Cynthia Pursley about that section of the law in May 2024.
Given that state and federal law requires public disclosure of case-specific information in child neglect fatalities, will you direct Department of Human Services to follow the law and turn over those records?
Our lawyers have traditionally interpreted the state and federal statutes as us not being allowed to disclose any information except to very limited groups.
And after we pointed that out, state officials at the time released information in June 2024 on 2 prior CPS cases they say indirectly involved Kennedy. We asked if the department would be releasing information in other child neglect deaths moving forward. And here's the response from then Governor Justice's Chief of Staff Brian Abraham.
What we're ever going to get to a point where we can give you the information, the file, those kind of things, you're going to get a summary, a short summary. So it's either going to be in close proximity to the incident or it's going to be at the end of the year. I think if we can do it quicker, it's better.
So we put that administration to the test. Days after that briefing, we filed this Freedom of Information Act request for any prior history between CPS and 4 children. Investigators say all died in separate cases of abuse or neglect. Some of those cases dating back to early 2021. Weeks after that request, we made another after the unrelated deaths of 2 additional children that summer. But all of our requests getting no answers. Instead, the department responding with delay after delay. Then finally a response that didn't include any summaries Abraham mentioned. Instead, a complete denial, as the department arguing the information is not public record and is strictly prohibited from releasing the information. The department only providing a link to an annual report, but that report having nothing on prior history. Fast forward to January 2025, a new year and a new governor, Patrick Morrisey. WSAZ quickly making our plea for a second look at our request. Wednesday, that plea the focus of the governor's comments at a press briefing.
When I first took office, I received a letter from a local news outlet about one of their Freedom of Information Act requests that has essentially been stonewalled and ignored by the previous administration. There was no excuse to keep this information shielded from the public.
WSAZ also receiving a full response from the Department of Human Services with all of the information we requested, but were denied by the previous administration. This as the governor making clear his stance on transparency going forward.
We are going to be different. We're going to be upfront with the people of West Virginia, and we're going to be as transparent as the law possibly allows.
In the response to our FOIA, the West Virginia Department of Human Services said of the prior administration, quote, upon further review, it is apparent that the information historically made public falls far short of what the law requires. So tomorrow I will be sitting down with Governor Patrick Morrisey about the changes and how they really will benefit the state's most vulnerable children.
All right. Hey, thanks, Kimberly. We will have that interview for you, by the way, tomorrow night then at 6 o'clock. Governor Morrisey also announcing 6 steps to improve transparency in the child welfare system.
Yeah, WSAZ's Marley Pinchuk is now breaking down those changes.
West Virginia Governor Patrick Morrisey announcing 6 steps Wednesday aimed at improving the state's child welfare system. 1. Providing increased transparency and disclosing additional information about child fatalities and near fatalities.
This is a major change from the failures of the past.
2. The state overhauling the child welfare dashboard, aiming to make it easier to use and easier to interpret data.
The new dashboard's going to allow for a deeper review and analysis, and it's going to include month-over-month and year-over-year trends to help us identify and fix any specific areas of concern.
3. Requiring child welfare supervisors to conduct monthly reviews with their cases. They would work with the state office team, identifying what is being done well, any opportunities for improvement, and corrective action. The governor detailing a part of that plan already in motion.
In March of 2025, the Department of Human Services launched an agency-wide leadership education and development initiative to strengthen supervisory effectiveness. The program includes all existing supervisors, 577 of them, who are required to complete a rigorous mandatory training curriculum.
4. Creating a critical incident review team that will work to determine if there was anything that could be done differently that might have prevented the incident. 5. Introducing a comprehensive practice model to provide a foundational framework that can be standardized across the state.
This is going to include changes to things such as intake, investigation, and services, and ultimately it helps shape the decisions of the staff and the leadership involved.
6. Implementing a new intake process where caseworkers could make additional contacts before a referral is screened in or screened out, or allow caseworkers to gather more comprehensive information on cases so it's not just relying solely on a referral.
What this means is that employees will now be able to gather information from relevant individuals involved in the case rather than simply rely on exactly what's in the referral. I think that's going to give people the flexibility they need to get to better decisions.
Changes, Governor Morrisey says, all focus on putting children first. Marley Pinchuk, WSAZ.
And according to the Office of the Governor, the changes come following a series of listening sessions that were held across the state with key stakeholders and a thorough review on past child fatalities and near fatalities within the child welfare system. We'll be right back.